Well, if your job has you working odd hours, it could be jeopardizing your health.
So says a new large-scale study in the British Medical Journal. Researchers found that workers who did shift work had a 23% increased risk for heart attack and stroke. Dr. Zorba Paster joins us from his clinic in Oregon. Hi, Zorba.
Hi, Zorba.
Hey, hi. Hope you guys are good.
This is not good news for our friends who work the morning show here, but what did the researchers define as shift work? What are they talking about?
Well, they looked at people who basically were changing. Well, shift work they defined as people who are changing when they're working. But it wasn't just defined that way. It's defined as people who work at nighttime, people who work 3 to 11, because when they're off work, they're changing their shift time. So in other words, let's say you work Monday through Friday, 3 to 11 or 11 to 7. On Saturday and Sunday, you're back in the day-to-day, your day-to-day life when everyone is sort of waking up in the morning and going to sleep at night. So they define shift work very, very broadly as people who are not doing the normal work hours.
So why are the late hours more at risk?
Well, that's a good question. That's what they found. They found that 11-7 was worse than 3 to 11, but they were both equally caused an increase in heart attack rates of 23%, as we said, and an increase in the nighttime shift of even more, up to 30 or 40%. Well, they think it may be due to the change in stress hormones. Adrenaline and cortisol, which are the hormones that wake us up in the morning, are also the hormones that may put us at risk for sudden death from heart attacks and stroke. And it's possible that shift work doesn't work exactly with our diurnal rhythm. And we've all seen it. You know, we stay up late at night on Saturday and Sunday, and it's hard for us to get up in the morning on Monday. It turns out this may actually be bad for our heart.
But could it be more other factors? Not getting enough exercise, not getting enough sleep, more than...
You bring up a great point. It may be exercise, it may be sleep, and it may be something else. It may be social relations. When I first started practicing medicine, I worked in the ER for a number of years, and I found the 3 to 11 shift very hazardous for my health because no one else was around from 3 to... everyone was doing things from 3 to 11, and no one else was around early in the morning when I wanted to play. So you're right, it may be diet, it may be exercise, it may be the social relations, but I think the bottom line is, because this is an increased risk, it's important for anyone who does shift work to make sure their cholesterol is under control, their diabetes is under control if they have them, their high blood pressure is under control, and then, as you put off, it's important to make sure you diet and you exercise the right way.
Good advice. All right, we'll let you get back to work. I like your shirt. I like your shirt, by the way.
Thank you. Thank you very much. From Land's End.
Thanks, Zorba.